Hi, everyone. Thanks for being with us tonight. We're going to go ahead and get started. My name is Nicole Hoschrung. I'm the Assistant Director in the Higher Ed Department at the American Federation of Teachers, and welcome to our presentation, What It Takes to Win Part-Time Faculty Healthcare. I'm going to let the panelists introduce themselves, but first I want to go over a few housekeeping. As many of you are familiar with this Zoom meeting format, which we're like for the chat, which is open, and the ability to talk to you more easily. You are in charge of your microphone, so please be respectful with that. Keep that in mind. This is also part of a series that the American Federation of Teachers is doing on faculty issues. Please join us for our next session on the 28th about Black faculty experiences. And the next session that will follow that is about student debt. And I'll put more information in the chat later. But with that, I want to turn it over to CFT President Jeff Freitas.
Thank you, everybody. Thank you, Nicole, for the introduction. Jeff Freitas, president of CFT. I recognize many of you on the screen. It's great to see some of you, and great to share some of the great, the fabulous work that our leaders, our champions, our contingent faculty, part-time faculty, adjunct faculty. We use many words throughout the country, and recognizing we're talking to people throughout the country. But fighting for healthcare and fighting for parity in California. And you're going to be hearing more from the people on the ground, the champions in our locals than for me. I just wanted to set this up about how this came about for a CFT priority. As you know, many years ago, AFT has been leading the charge. I want to say that there was a line item in the California budget 20 years ago from the work that AFT and the national work that we've all been doing to provide healthcare for part-time healthcare. And it was a very minimal $500,000. And just these numbers that I throw out recognize that California is the largest budget. And we actually probably fund education as much as the federal government. I think this year's funding for education K-14 is $110 billion. And we know that's larger than many state budgets on the call. So stay with me on these numbers. But $500,000 for part-time healthcare that's supposed to be applied throughout the state. The problem with that is if districts were paying part-time healthcare, they were literally getting cents on the dollar. They were supposed to get up to 50% according to the law. But they literally were being rebated 5 cents to the dollar, or 5% of what they were paying, what the employer portion was paying, and nothing was rebated for the employee. In 2019, we had a strategic plan. One of those 4 points in our strategic plan was to demand equity in higher education for faculty and students, and this is along with what AFT has been doing. Advocating for free community college. We have that in California for those that come out of high school, tackling the student debt crisis. AFT has been an amazing lead on that, and we've been doing that in California with AFT and advocating for faculty equity and pay, benefits, and working conditions. And that's where this bubbled up. This was going to be an amazing campaign in 2020, and we know what happened in 2020. We were focused on saving lives, saving jobs, and transitioning to remote work. As it was created opportunities to have these type of webinars or conversations, but also was not how we wanted to get there. We got through that first phase and became a priority for us. In the meantime, California saw a massive amount of increase in our funding and our revenue in the state of California, and this became a great opportunity. We saw it as an organizing campaign. So our goal with this campaign was to reach closer to a contingent faculty, what we call in California part-time faculty parity, trying to get equal pay for equal work, including equal benefits and part of that pay, making healthcare affordable throughout the state. And finally, it's also union building. This is a compounding effect. So the more that we can win for our members, the more they get involved, the more we can continue to win in other avenues. So it was a union building activity as well. We dedicated resources. We hired a staff person. We got regular meetings with our local leaders. They're going to go into that. We got input resources from AFT to focus on this. And we made this a major effort. And it's not just at the legislative win, and they're going to talk about the details, but it's also what we had to do in our locals and on the ground. And it's been an amazing. We've learned a lot of lessons on how to transition this, how to do a statewide campaign where some locals are more involved than others, and some are getting bigger wins. And we're developing that. And we'll be taking those lessons and doing other campaigns as well to be able to get better parity and equity with for our members, especially in the higher education. The one thing that I would say before I hand it off is we were really wanting to do a statewide campaign to bring it to the Capitol. We went to the governor before his first budget proposal in January. We said this is going to be a high priority. It also was connected to having more hours at a single site as opposed to having this freeway flyer issue. And the next thing we knew, he put it in his budget. So our strike readiness didn't have to happen because he gave us what we were asking for. So when we go back to the number, we went from $500,000 a year to provide for this funding to $200 million a year. It's not one time, it's not a fund that gets there, but it's an ongoing funding and a promise. Every year is a different budget year, but it's a promise for it to be ongoing, and it will pay up to 100% of what the employer pays. That's what they reimburse, the employer pays. We're negotiating everything. So I'm going to hand it off to the champions that are doing this. That's just the background and what we did at the state level. But Chase, are you the person that I handed off? So the person that we hired to lead the staff campaign of this is Chase Golding. I'm going to hand it off to Chase.
Thank you, Jeff. Thanks for your leadership and kicking us off tonight. So I guess I'll introduce myself and pass it over to Saya and John to do the same, and then we'll get into the other slides. So Chase Golding, CFT part-time faculty campaign coordinator. John?
Hi, everybody. John Goski, glad to be here. I teach digital media at Cabrillo College as a temporary employee for the last 20 years. And I'm also a CFT vice president and co-chair of the CFT part-time faculty committee. And I'll pass it off to Saya.
Hi, everyone. My name is Saya Rokia. I am an adjunct. I'm a part-time faculty member at a couple of different districts. I'm also president of Adjunct Faculty United. That's in our name. If we had to change it, I think we would be ASS or something like that. And I've been part of this campaign since the beginning, and Chase has been amazing, and John has been amazing, and we all love Jeff, and I'm excited about talking to you all. So thanks for having me.
Thank you. I realized I didn't say anything about myself, so I'll just say I'm a union organizer, 15 years or something like that, different sectors. I live in Los Angeles, close to Saya. So our campaign, there's a little funny problem with the language. So we have 5 bullets we're going to talk about, which is why healthcare, language, and John's going to cover those, and then I'll get a little into purpose, our purpose of the campaign, some of our principles and our practices. As you see this photo, you can look for John and Saya in it, or Layal. I think Marlo might be in there. This was at our lobby day. So John Govsky, take it away.
Oh, thanks, Chase. So just a couple of words about language and how we refer to ourselves and what's going on in California in terms of that. My personal pronouns are he and him, but my noun is not adjunct. And if you ever look up the definition of the word adjunct, it says a non-essential piece of something. So given that that's inaccurate and pejorative, we've tried to move language away from that. In California, we generally use the term part-time because in the community college system, legally, we can't teach full-time. So part-time and contingent are synonymous within our system. So that may not be true in other parts of the country, but we generally use the term part-time, even though what we're talking about is really contingency. That's really the defining feature of our part-time faculty. And so I just wanted to give a little spiel on that. I also wanted to say that in California, We use the term freeway flyers to refer to people that teach in multiple districts because they have to, because again, we can't have a full-time load in one district. So if you hear us say frequent flyers, that means people that teach in multiple districts, because I know California lingo can sometimes be different. Why healthcare? You know, it must have been about 2 years ago when we were in a community college council meeting in California, and we had decided that it would be a good idea to have a statewide campaign and focus on some single issue and really marshal our resources in a concerted way to bring everybody together to be as effective as we could in organizing and moving the needle. And in our first discussion on that, a lot of things were proposed, including working on class caps, because that affects everybody and so forth. And remember, the timing is about 2 years ago or so. We're in the middle of the depths of the pandemic. And I said, you know, we're in a pandemic and most of our faculty don't have healthcare. While the majority or virtually all of our full-time faculty have really good healthcare in California in our community college system, the overwhelming majority of our part-time faculty, which is the majority of our faculty, do not. And so I said, hey, this is the time to focus on getting people healthcare. There's a moral imperative here. We're in a pandemic. Our enrollments are dropping, so people are losing assignments. If they have benefits, they're losing them. And most people don't have the benefits, and we need to change that. And I think very quickly, everybody in the room kind of said, yeah, this sounds like a really good statewide campaign. So one thing to understand about California is that it's a very large state, and our community college system has 72 districts, each with independently negotiated contracts with locally elected boards of trustees. So we have to take into account the fact that we need a decentralized focused campaign, but also at the grassroots level, we have a lot of different bargainers and a lot of different contracts. So this was a very complex thing to kind of put together, and Chase was masterful at that. So we decided healthcare was the best focus for a couple of reasons. And as Jeff mentioned, there was also the governor kind of he kind of laid it out for us to do this in a veto message of a previous bill on trying to increase the amount of hours that part-timers can work at one district. He vetoed that bill, saying, well, it'll be too expensive because too many of them would qualify for health care then, you know, gee, like that's a problem. And so that would cost districts a lot of money. So we need to deal with that in the budget, not in a bill. And so then we said, okay, well, let's talk about getting a significant chunk of money in the budget for healthcare that we can then figure out how to get the locals to grab at the negotiating table. And so that's how we came up with healthcare. And I'll stop there, Chase, unless you want me to keep going.
No, thank you. And, you know, just to piggyback on John with the why healthcare, you know, one of the first things that I learned when I was getting trained as an organizer was when you're trying to figure out when you're trying to help workers figure out what issue they should prioritize in a campaign, widely felt and deeply felt. So healthcare is top 3 in every survey I've ever seen, you know, so it's, we're all here for resource redistribution in its various forms. And that's one that affects people directly in many ways. So, you know, as far as purpose, I think the best way to talk about the purpose of our campaign is just to screen share a little bit of language that we put together when we were sort of in the brainstorming phase. So this is just a tool that we use in planning sometimes where we call it POP. So I just call your attention up here to the purpose of our campaign. Then, you know, this isn't something we like brand or give to management. Just make sure that we're working from the same place, right? Is to build power and improve conditions for part-time California community college faculty and their colleagues and students statewide. To achieve this purpose, we're going to mobilize members, coordinate legislative research, bargaining, and internal organizing programming. So you're going to hear about each of those 4 components today. The outcomes we're looking for, this was done in like the 2nd month, and I'd probably stand by it. Let's see, build part-time and full-time. If we get to, I don't know if you all are in wall-to-wall local unions with both part-time and full-time in the same local or job site. But if you are, then you know that the number one thing to keep your eye on is maintaining solidarity, because friction happens a lot. So we need to have like at least 30% of all campaign participants be full-timers, or we lose the part of the union that has the most institutional power. In any case, build part-time and full-time faculty union power through legislative and contract fights that increase member involvement, build activist infrastructure, not just mobilizing, but building teams of activists that the local can then count on to move the work of the union moving forward. Improve healthcare access, quality, and cost via legislation and then bargaining, because we passed enabling legislation and then had to bargain it in like 27 different CFT represented districts at once. Hear about that too. And then develop an inaugural conference for part-time faculty and their allies, and ongoing training curriculum to deliver what people need to change, to make the changes in their lives that they need to make. So that's our purpose. And then as far as principles and practices, some of you are involved in those on a weekly or monthly basis. So principles, are the same principles as any other union organizing campaign. Be strategic, escalate actions, collective worker originated ownership at every possible step. And then the number one principle I would say is about union building and capacity building. In everything that we do as a campaign, we must do it in a way that builds our union. If you can do it for someone, okay, maybe you have to because you're crunched for time, whatever. But if you instead, we try to do it in a way that increases activism and knowledge and leadership among the members who are leading and working on this effort. So, and that's why I think you see so many smiles. So as far as practices, we have one monthly statewide campaign committee meeting that is strictly 60 minutes. Although people stick around after, we do Q&A as long as they want, but the meeting itself begins at 4 p.m. on the third Wednesday and ends at 5 p.m. That's the main vehicle. And then we have on the first Wednesdays, we have a bargaining work group that meets. We have 27 local unions in CFT that have part-time faculty, which is the majority of part-time faculty because it's the large districts. Each of the 27 local so coordinating, I don't know if it sounds easy, but I know that it's not. You would think that it is because we're all part of the same federation. We're all bargaining the same topic at the same time, sharing the same priorities, and that should make it relatively simple. But these districts and probably regions of where many of you live have their own independent structures, cultures, practices, things that interfere with coordination. So as far as practices that advance coordination among the locals, things like having online toolkits, each local union, if you're a local union, you're participating in this, just who's the point person? One point person, two people are responsible for something that nobody is. So that's another practice that's important to the successful coordination is one member point person per local, one CFT staff point person for that local. And that's how we get the ship flowing. Saya, I think you had to drive to your appointment, but I wanted to see if you wanted to add anything on this one or John, before we go to the next one. And if you're driving, please don't get in a car wreck for me.
No, I haven't stepped away yet. I'm trying to, but yeah, John, if you want to go, I think I'm really going to talk more about when we get to the right. Lobbying, and all that stuff. So you can carry on as you are. Right.
Thank you. So campaign development. So I think John can speak about the status quo of part-time faculty healthcare pre-campaign and some of the steps we took to develop what ended up being this policy, and resources and staffing.
So so the status quo before the campaign is essentially the landscape that the large majority of our part-time faculty did not have any healthcare. A smaller percentage of our part-time faculty had some healthcare, and then a smaller percentage still had really good healthcare. So And of course, in a pandemic, that's kind of important. Also, an era of declining enrollments. Enrollments were declining somewhat rapidly a couple of years ago. Many people who were lucky enough to have their benefits were dropping under the threshold of, let's say, 40% of a load, which is a standard threshold to receive them in many districts, and we're losing them. So the status quo before the campaign was that we need to get people healthcare, and we weren't really anywhere near getting most of our members healthcare. So that was pretty much the defining status quo. And of course, we also were just bringing on about the same time Chase as a full-time organizer for part-time issues. And by the way, AFT, thank you, because AFT funded half of Chase's position. It's a 2-year position. And so CFT and AFT put resources into this in a very real way, which is part of the reason I think it's been a very successful campaign, is the commitment and focus of resources on the campaign. So all that came together, the pandemic, people not having healthcare, people losing assignments, the governor giving us an invitation to basically lobby for more money. And as Jeff had mentioned, there was a fund to provide some money for districts to provide for healthcare for their part-timers, but it was like a joke. It was less than $500,000 for the whole state. So it was really a joke, and there was really no money there. And so all that brought us to the conclusion that this is a logical focus, and we can actually make a difference if we do this in a coordinated way. And so getting into the developing policy bullet item here, we were like, well, what would it look like? How could we get people healthcare, given that we have, 72 different contracts that are all, sorry, hang that up, 72 different contracts that are all locally negotiated. And it's kind of a patchwork of stuff. So we came up with the idea of securing money at the state level with conditions that would help the local bargainers to get that money more easily from the district. So it wasn't enough just to say we're going to get a huge chunk of money, although that was good. It wasn't enough to say that we're going to get a huge chunk of money, but it wouldn't be ongoing. So we were originally very worried, well, maybe we'll get some money, but it won't be ongoing. And a one-time allotment is not enough to get districts to commit to long-time healthcare. So we said, okay, we need a lot of money. We need it to be ongoing, and we need to attach conditions to the money so districts don't just pocket it and use it for something else, which we've seen happen in the past with all kinds of different allocations. So we came up with the policy of we need the districts to cover anybody with a 40% load or greater, offer the same plans to full-timers to part-timers. The cost of the part-timer out of pocket, the monthly premiums can be no more than what a full-timer would pay, which is essentially zero in many districts. And that we also wanted to come up with a way to cover freeway flyers who might not have enough of a load at one district to qualify for a 40% threshold, but would by combining loads. And there are a lot of people like that in California. And this is like the first time we've actually, in a coordinated way, tried to make the point that all these people that are atomized in different districts are all working for the state, and they're not necessarily working part-time, even though we call them part-timers, because they have multiple loads in different places. Then they deserve healthcare just like everybody else. And we were successful at getting those conditions attached to this huge amount of money. And that made it easier to negotiate at the bargaining table, because districts are getting 100% reimbursement if they follow the 4 conditions. That was key.
I think it's key too. I mean, it's key because we can't advocate for funding that will drive poor quality plans that are unaffordable, inaccessible, and different than what our colleagues get, your colleagues get. So, and the 2 things I would add on this one is that the book was not written on this. Some of the more difficult conversations I've been part of in the last few years were conversations about what model should we be pushing. I mean, for example, you'd like to just pass a law that says you must, if you hire part-timers, you must give them healthcare, legislative fiat. But at least in California, the legislature does not really mandate subjects of bargaining. So that was out. wanted to look at pools, either statewide and or regional, Taft-Hartley labor management trusts. That's very time consuming. This was something that we could pass through the budget process without a sponsor, without a fully developed policy at the time that it began. And it doesn't mean it's the end, and it doesn't mean it's necessarily a less effective model, but it's where we ended up at, and it's good. And then resources and staffing, as the lucky recipient of that here, my take is that a statewide, federation-based campaign that involves many locals and coordinates them in a real way, I don't think it can be done without one person as the person responsible for coordinating it. I just don't think it can. So even if you have maybe if you have a really tight team of 3 people and they sort of operate as one, but for us, it's been very important that there's one person doing it. So is this our next one? Am I right about that? Okay, sorry. Okay, so moving on to how it works. So John gave you a little bit of this already. We'll get back into it now. So, the model for the legislation. So, and I don't know where everyone's from or how this works where you're from, but here, the legislature will often incentivize behavior changes by public sector employers like community college districts by saying, we want community college districts to pay for some office hours for part-time faculty so that students can have more access to the faculty teaching them and graduate at higher rates, transfer, what have you. So since districts aren't doing it, we create a pot of money. And if you give part-time faculty office hours, we'll reimburse you 50%. That's a model that's been in place for many years, decades here, but it doesn't work that well in most cases. So how this policy works is it takes that model and builds on it. So if you take an existing practice and build on it, it minimizes resistance that you'll face among the legislative types and management. So instead of saying, give part-timers healthcare and we'll reimburse you half, it says, do what you're doing, give part-timers healthcare and we'll reimburse you half. And if you want the other half too, if you want the state to pay for the entire cost, that's fine. You just have to meet 4 conditions. Has to be quality plans, has to be accessible, affordable, and take care of freeway flyers. To reiterate the specific 4 conditions that John shared, which we can get into, or if you want to now. So, we legislated that, and then, which is called enabling legislation. And then because healthcare is a subject of bargaining, you go bargain the implementation of the law. And so there's 2 phases to this campaign, and we're in phase 2, bargaining. Maybe there'll be a third. So, just to reiterate those 4 conditions. So again, we don't want to be in a position where our members sacrifice time, energy, go to Sacramento to lobby in person, put in hours every month or week, and what it results in is cash for their bosses, or excuse my language, but crappy plans that you can't qualify for or purchase anyways. So if we're going to fight as a union of members to get money for our bosses to give us what they should be giving us anyways, let's make sure they're doing it the right way. So what the law says is, at our behest, yes, you can get half it paid for, and if you do the right 4 things, meet the 4 conditions, put strings on it, then you can get it all paid for. Pretty hard thing to pass up when the cost is millions. So do you want to reiterate the 4 conditions, John, or should we keep it pushing?
I'm going to post them in the chat. Everybody can see the chat, correct?
Perfect. And we got a lot of material.
I'll post a description of this in the chat, so that I think that'll help people. So go ahead, Chase.
FAQs out the wazoo on the campaign website, which we'll put in the chat again as well. So a lot of that stuff for you if it's helpful. So I think we're going to do organizing and then legislative and then bargaining, and then we conclude. So we're doing well on time, and we have a lot to say that we haven't said about all of this, but let's, protect time and then take questions and stuff like that. So this is a photo from lobby day. That was a lovely photo. As far as organizing, the lifeblood of our movement, in my humble opinion, it is not enough to win benefit improvements with members for members. That's not enough. If we're doing that, but we're not building our union, which needless to say is at historically low strength and participation as far as density in the American labor market, that's not enough anymore. It's important and it's critical, and people's lives are depending on it. And as part of a movement, we're responsible for the vitality of our movement as well, and our organizations that we comprise. So everything that we do in organizing in this campaign, everything we do in this campaign, we try to do in a way that also builds our union. What I mean by that, so for example, the difference between mobilizing and organizing. Let's say one of the 27 locals, now that we're bargaining, hey, we need to go to the board of trustees and do an action. We feel like if we can get 25 people there and 5 of them will speak, it'll send a really powerful message to the elected trustees about people care about this. It's the right thing to do it. And so various ways to get 25 people to a meeting. You could send hustle texts and emails. You could visit the worksite and flyer. You could just directly call the people who went to the last few actions. I would term those as mobilizing. I would not term those as organizing. The difference is the activities I just described don't leave anything behind. After you call those people and send those emails and those hustle texts and they come and it's great and you go home, you don't have anything that you didn't start with, right? You want to do it a second time, you're going to do the same amount of effort and time. So instead of that, a different way to mobilize those people would be to build a team, 3, 4, start with whatever, who says, I care about this enough that I will take some ownership of this and put in real work. And then that team, by moving the action in a member-to-member way, and because they're taking ownership, they're tracking their data because they know that they're gonna want that information for the next time, and building teams of activists along the way. That's what we mean by capacity. Everything that we do, we try to do it in a way that builds teams of activists. So that's what the next bullet is, developing teams and leaders. So I'm big on team. I like being parts of teams. I think they help sustain me through difficult work and times, and they make this outcome like greater than the sum of its parts. It feels good. It's part of union. And so in theory, every local should not just have that point person, but that point person who comes to the monthly third Wednesday meeting, then brings that content back and drives the campaign at their local, if they can, by developing a team. So that is the way that this campaign can move in a way that develops teams and leaders. As far as leaders, so many opportunities for leaders to develop their leadership on this campaign, on any campaign, right? Giving testimony, strategizing. I'm learning way more. I thought I was kind of done learning. I was like, yeah, I've been organizing for like 12, 13 years. Like, I don't really want, I kind of, have done like different types of things. I learned that I know nothing about legislative process. So I got to learn that and healthcare policy, which is, for me, really hard. So a lot of opportunity, people are picking up a lot of skills. The cross-pollination among locals who coordinate their efforts, especially locals who like share a border or a region, has been instrumental for that development because they're sharing practices, documents, lessons. It's accelerating that. Lastly, escalation and campaign. Just like in any bargaining or other campaign, we escalate the tactics that we use. So more intense and larger tactics over time, both in the legislative phase. And of course, now that we're at 27 tables or, 20. So as far as campaign activities, in the legislative phase, we sent 3 Action Network letters where you basically click and it sends a letter to your legislators. 3, it was a January, a March, and a May to close the deal. Each had higher participation. I think our biggest one topped out pretty high, like 3 or 4K. The other major legislative phase campaign activities were, we did a comprehensive survey. We were very lucky to have this research director, Amy Schreck, who developed a survey that took 15 minutes to complete, and asked met with each local and conducted a meeting with them about how they can effectively distribute the survey to their members, and really drill down at the local level. I had 2,500 responses. So that's really high for a survey, especially a long one. So the way we were able to do that was just feeling like we need this information. We have to have this information. That information doesn't exist anywhere on earth. How many adjuncts are there? I'm sorry, I come out of LACCD. That's how we talk. How many part-time faculty are there in California? How many of them have healthcare? How do they get their healthcare if they don't get it through work? Or do they? How many get it from a spouse or dependent or a second job? That information does not exist. Not in the legislature, not in the chancellor's office, nowhere. So we were like, well, we need it, so we better do a survey. So those are our campaign activities. And now that we're at the table, I'm sure you're familiar with the associated activities to support bargaining. Next is legislative.
James, can I just?
Yeah, please. I was going to say.
One of the things that's been really, really helpful in this campaign has been the fact that many of our locals are negotiating simultaneously for the same thing. And that hasn't really happened before in this way in California. So I'm currently at the table. I think Say is currently at the table. And so we have these periodic meetings where we share our experiences and we find out from other people, oh, well, our chief negotiator for the district just said they heard from the chancellor's office, blah, blah, blah. He's like, oh, really? Well, we didn't hear that yet, blah, blah. And then, where's the pushback from your district? Well, they don't want to give us immediate eligibility. They want to have a year waiting period. Well, what about you? No, we're going to get immediate eligibility. Oh, really? Then we're going to push back on the 1 year waiting period. So we've had a lot of crosstalk of the negotiators themselves on the bargaining teams and those in the executive committees of the different locals. And that has really made a difference and made for more effective local bargaining. It's kind of like we're part of this organism now, whereas before we were just a little more atomized and by ourselves at the table. And that really makes a difference when you're a negotiator at the table. You really feel like you're part of the bigger network, and you are. Sorry, Chase.
No, that's great. There's a bargaining slide where we'll get, more into that. I think that's really exciting. Of course I do. It's my job, but I actually really do. And I'll preview some of that, like John said, when union leaders realized that, hey, we're all going to be bargaining the same topic at the same time. What does that mean? Because bargaining, at least where we live and work, is sort of sacrosanct. It's the part of the union that the people who are experts in that area are more reticent to sort of involve others. It's a little more siloed in most of the unions that I've been part of than other elements of the union. So it was exciting to see it open up and sort of blossom and coordinate. But we didn't hear more from Saya and John on that slide momentarily. So Saya, I'm gonna turn it over to you on the lead stuff. Anything you want to add on this one first?
Yeah, I think, hi, everybody. I'm in the car now. So if I get choppy, please somebody say something. Yeah, I think the really great part of working with the legislators is, first of all, Chase, thank you so much for the organizing that you did to get us all together. And John, you really hit it right now when you said that we're all doing this together, and that gives us the power, because the contracts we win are a reflection of the power we build, and we're building California-wide power, and it's amazing. So with that said, going in with the legislators, the really great part of that, Chase, was those testimonies. I remember you telling me a story. One of our members that we sent your way actually made you cry, you know, hearing that story. And so hearing these personal narratives and these testimonies during the budget hearings, that was really, really super important. And it gave our members buy-in. First of all, they get to speak about something during COVID and beyond. I've got a couple of stories to tell when it's ready, when we're ready for that. But it gave our members a chance to like speak about something that was going on with them in the health. That's the most personal issues that we could have as a human being, and to have a space for people to talk about their stories was incredible. And then to bring it to the budget hearings and to bring it beyond in other board of trustee meetings and things like that, it brings a humanistic quality to what we're fighting for, which is healthcare. It's a human right, and that's, you know, the best part of the whole legislative moment was to have these personal narratives and to get to know some of our legislators in our districts and get their support as well. And we do have some support from our legislators that are willing to write letters and things like that for our action on March 14th. So it's just exciting stuff, really, really exciting stuff.
Thank you for saying that. So, I mean, that brings up a couple of things for me too, that I think we should share. So, you know, one of the goals of this webinar is, hey, many of the attendees, they don't live in California. So make sure that when you talk about this, it's not in a way that feels unachievable in a less, you know, government spending friendly area. And so leading with human interest, leading with what is human is one of those things. I've been lucky to organize in Colorado, Kentucky, Minnesota now is kind of like that, Arizona, but like everywhere that I've ever, you know, built worker campaigns, that's what moves people. Whether you're a gas station clerk or a cop or a politician or whatever, you know, that's what moves people. So you know that because you're union leaders and you don't go, you know, when you speak to politicians in public, it's not about numbers and policy, and it's about human interest. But like that, it works, right? And so the other piece of that was that I think that's part of what makes healthcare a good organizing issue on this one, because class size, great organizing issue, good for community partnership, learning outcomes, directly related to working conditions. I can't imagine you will be able to solicit the same quality, depth, moving stories on issues of class size that you get from faculty who open up about very personal and powerful to them scares and situations that they and their families have been in. So it's a great opportunity to pull out those, to help people pull those stories out and tell them in the most effective way. And that's also union capacity building. A local involved in this campaign should be building a list of members who can share stories like that, because guess what? It works everywhere, and you're going to need to be doing it in multiple forums. So just to editorial.
Yeah, let me just add to that. We talked about different phases of the campaign, like the statewide phase, now the local phase, but really they bleed over together, because all along we've been having at the local level, our members tell their stories, for example, to our trustees at trustee meetings to kind of soften the districts up for the bargaining that we knew was to follow. And, you know, there's nothing more powerful than somebody speaking about their personal experience about not having to be able to have certain healthcare for their family because they couldn't afford the coverage, even if it was offered to them from the district as a part-timer. And the personal stories of people who had healthcare, but then lived in fear of losing it, because if they lost one class through no fault of their own, they lose their healthcare for their family. I mean, those stories were incredibly powerful. And we had somebody talk about the fact that at one of our local trustee meetings, she had lost a class, she lost her healthcare, and then her child needed some major healthcare, and it was like a $16,000 expense just because she was in that gap, but she lost a class, lost her healthcare. And she was one of the lucky ones that actually had healthcare for some of the time. And these stories are intensely powerful in a way that talking about why you need a raise or why your class should be smaller. Yeah, that's important. But the moral imperative on healthcare, I mean, like, this is the bread and butter of what unions should be doing. This is real union organizing work. If we can't get healthcare for the majority of our members, then what the hell are we doing, is the way I put it. So I'll shut up now.
That's beautiful. And just from a personal note, like people like John and Saya and myself, and I think a lot of you who sacrifice a lot for your organization and work on some pretty challenging efforts, it gets tiring. And stories like that we find keep us going. So it's got all kinds of pluses, right? But, you know, in any case, regarding legislative advocacy, so heavy research component to this campaign, which has been tremendous for people like me who can barely read. I can read, but you know, not some of the important materials for this. Member story development was key for lobbying. We actually did our conference on a weekend and did the lobby day that Monday. So we paired them as two events. That worked really well. And the outcomes of our legislative, and after this, turn over to Saya to talk more about, you know, these elements, the outcomes of the lot. So we put 100 faculty in the Capitol, you know, which may not sound like a lot, but I think 20 different locals, a third of them are full timers, very representative of how our membership, you know, looks and identifies. Heavy preparation, the conversations were effective, the information was tracked. So that's kind of all that I know to want out of a lobby day. Member experience was high. The vibes were immaculate. So that's some basics. Let me turn it over. So Saya is the leader of a local that has taken a high level of ownership of this camp. This campaign doesn't work if locals don't take ownership. And there's degrees of taking ownership. So I one of the reasons I appreciate Saya and her siblings Marlo and Layal is the level of ownership that ADFAC has taken. Not because, you know, it's a CFT project or because you know, for any reason other than it's the right thing to do. Our members need it. It's achievable. They're doing it. Let's jump on board. And they have dove in. I want to say we have 27 locals, but I want to say we couldn't really have done this without y'all. You've been instrumental. So definitely sort of a top 3, top 5 local leading the way. So, and undergoing deep transformation on a years long process. So shout out to my sibling president, Saya, and who's going to talk more about legislative advocacy.
Sure. Thanks, Chase. And yes, I would be remiss if I don't give a shout out to Marlo and Layal, who are also here. Marlo is our chief negotiator and is just, I have some stories to tell about how she is really not backing down at all. And Layal was part of our lobby day. And it was just an incredible, absolutely incredible experience. And so what do you want to hear about this, Chase? Just like what our experience was?
You know, I think whatever comes from the heart from you is going to be great. Experience is really important. Not like logistical, you know, but like, I don't know who. So I thought maybe we should have done a round of intros at the beginning, because like I'm not sure if we're sharing space with, you know, local presidents or sort of like part-timer VPs or like. So we could do, or
even
that.
What states people are from as well.
Do you want to do a roll call? Should we do a quick roll call? Let's do a roll call. Maybe like James, Frank, Carol, and then go from there.
Hi, Jim Parisi. I'm a field rep and I'm a lobbyist for the state Fed in Rhode Island.
And I'm Frank Flynn. I'm the president of the state Fed in Rhode Island and an AFT vice president.
I'm Carol Mintus. I'm a staff rep for AFT Pennsylvania, and I support all of our higher ed locals across the state.
Thank you. And then I see, I'm not sure if all these people are at their computers, but I do know that Deborah, Andrew, Marlon Layalar.
Hi, I'm Deb Takehara. I'm a field rep in Illinois. I work with a higher ed unit in the city here.
Hi, everyone. I'm Andrew Cantrell. Deb and I are colleagues. I'm also in Chicago, and I work mostly in higher ed.
Sisters from North Orange County, Marlo Layalar.
Yeah, I guess I'll go ahead. I wear a lot of hats. I won't say adjunct, but I am a part-timer at North Orange County Community College School District. I teach ESL. In our union, I function as the VP for our campus. I'm a member organizer part-time, and I'm the lead negotiator. So we're in the thick of it, been trying to win full healthcare for our members. And as per usual, it's proving to be an arduous slog, but we'll get there. We're going to win it. We're going to do it. So that's my spiel.
Awesome.
Hello, everyone. My name is Naya Lipte, and I'm also a part-time instructor at an OCCD. And I'm also an ATAC member organizer, also a representative at the Senate meeting, and I recently joined the negotiation team with ATAC.
And then I think to close us out, we have Lisa Conley, Alyssa, Nicole, we heard from, but and Nicholas.
Hi, everybody. I'm Lisa Conley. I'm president of AFT Local 212 at the Milwaukee Area Technical College. And I'm also vice president for tech colleges in the higher ed sector for AFT Wisconsin. I have a important thing in that we're the only higher ed union in the state of Wisconsin that has a part-time faculty bargaining unit. So we've got full-time faculty and part-time faculty as well as paraprofessionals. And we are currently still living under the wrath of Scott Walker in Act 10. So we are a right to work state in a state that's worse than right to work. But we just had a progressive candidate, Judge Janet Protasewicz. She won her primary, and we're hoping that we'll be able to flip the Wisconsin Supreme Court and get some fair courts and some union power back. Thank you.
I think we went Alyssa, Nicole, Nicholas.
Hey there, friends. My name's Alyssa Picard. I'm the director of the Higher Education Division of AFT. I know many of you through this work, became an AFT member myself as a graduate employee at the University of Michigan, and then worked for our state federation in Michigan and also as an adjunct myself at Wayne State University in those years. So super glad to be having this conversation, and in particular grateful to my colleague Nicole for sort of collating everybody together in order to be able to have the discussion tonight. So thanks all for being here, and thank you, Nicole, for the planning and the work.
Seconded. Nicole really has been great.
Thank you. Thank you all for being here. As I said at the top, my name's Nicole Hochsprung. I work in the higher education division at AFT with Alyssa, and we are really excited to be bringing this and future conversations about part-time contingent faculty issues to you.
Thank you. And so, Saya, I would, since we have a mix of a lot of different types of people, one way to talk about it is sort of like, what was it like to be part of leading this legislative advocacy effort and then go to the table? It is a question that might help you. And if you don't like that and want to talk about something else, you should do that. And also, if people want to hear on a specific topic, if you can put in the chat and turn it over to Saya.
Yeah, thanks again. So I do want to preface who we are. I'm sorry, it's in the name, Adjunct Faculty United, AFT Local 6106. We are the only, the largest part-time only union in California, part of the 72 districts. So We have done a tremendous amount of organizing and mobilizing exponentially. So that is pretty amazing, and it's hard work because we are all part-time. Like me, we're at different jobs at different sites, constantly earning our freeway flyer miles, and so it's really hard to stay focused. But because this is such an important issue, and because this is something that is near and dear to all of us, it is something that we prioritize. So I appreciate what you said about AdFact, Chase, and it has been an incredible experience for us. Our board changes every 2 years, and so we have a whole brand new board right now, starting in May of 2022, and so this is our first time being at the negotiating table with this new board and getting to know these board members. Really, on lobby day is when I got to know a couple of our board members and what they're capable of, and the way they speak to legislators and aren't afraid of telling their stories to the legislators. And we have one board member who dragged me all over the place when we were in Sacramento, introducing me to different lawmakers that are in our district. And that has proven to be really important, because now we can contact that office, which we have, asking them for a letter of support when we do our action on March 14th. I think I mentioned that earlier. And it was from being at lobby day and getting that business card and having that conversation that then the next time I saw Senator Newman, I was able to say, hey, we met you in your office, and you invited Naveen and I, and we had this conversation, and he remembered that. And it's that relationship that we just keep utilizing, and he's willing to do anything that we need. He supports this, and this is going to help us when we go for our third round of negotiations next week, because we are being stonewalled. We are being told that they're not going to give us these 4 agreements that are part of the terms and conditions for 100% reimbursement. And so our next phase is going to be to go to the Board of Trustees and say, hey, what gives? They're going to leave all this money on the table. And we've got these figures and these facts that Amy Schreck has put together in her research at the very beginning, and the communication that we have with the Chancellor's office and Michael Young, who is very well connected to our legislators. All of this discussion we talk about once a month, and we find out what other locals, our neighboring locals, like Chase mentioned, what are they doing? What's the pushback you're getting? What did you say when they said that? And that's what we're doing. We're keeping a running tablet going in a shared drive with Chase as the central hub, so we all can keep this information going back and forth with each other. And it's just been absolutely incredible. The personal stories that we've been hearing from people, this is something that Marlo said to our finance guy, was saying how they can't afford it. And Marlo flat out said, well, Fred, that's the price of doing business. And I couldn't feel more proud at that moment than I did, because she just called him out on it, And again, last week when we were in negotiations, same thing, the money, we can't afford it. And then they said, not only can we not afford it, but it's going to be an administrative nightmare. How many of you have heard that before? Right? That's the latest thing, the administrative nightmare and the affordability. So we're going to come back. We've got very tactical advice that we've been gaining from our communications with everybody, and it's helping us. And another really cool thing from our meeting around Valentine's Day are the locals that took Valentine's Day actions, and they had these signs that said "Have a Heart," and how incredible was that? They gave Valentine cards to Board of Trustees, talking about the healthcare, have a heart. And the timing of everything has to be so perfect. And so right now, ours is going to be about showing the Board of Trustees the facts and the numbers and the research. And, from what I understand, 167 million is the high end of the spectrum. And the governor has given us 200 million. So we're not even going to hit that 200 million mark. But the Board of Trustees, the negotiators will tell you that you are. So that's kind of the whole thing. Communicating with everybody has been very instrumental. finding those perfect opportunities to make those impact statements with our board of trustees, very instrumental. I think I am breaking up now because I'm in front of a hospital. So yeah, there you go. Yeah. So that right there, man, like this is the stuff we do, and we're in communication with everybody. Like all of us are talking about it, and it's the solidarity within CFT locals has just been incredible. Just that power of numbers has been incredible, and I think we're going to win this thing. I think we're going to win this thing because 7 have already done. You know, and why can't, you know, I told our chancellor, like, wouldn't it be exciting that we can be in the top 10? You know, and of course he didn't really respond to that. So that I sent him a text. So I just do little things like that. You know, I'll send a little text here and there to the chancellor, you know, just to keep things on the radar, you know, with where we are and what we're doing. And I think that's really important. You know, we've created a good relationship with our chancellor, and we're lucky to have the chancellor we do. So I think that's a good, you know, that's a good thing we do too. They were monthly problem solving meetings, but right now they're monthly healthcare problem solving meetings. So we have those with just directly with the chancellor and our board members as well. So that's been really helpful. So,
you know,
I don't know, anything else?
Well, something that you said made me think of this. So like, first of all, if any of you are seeking to, you know, implement something similar or replicate some component of this, we'll give you our phone number and emails, right? And you can reach out. We'll be helpful in whatever way we can. That said, you know, something, Saya, that you said, maybe like, I don't know if this is worth sharing with, I think for some of you it will be, but there's a really interesting balance to the strike. And this campaign has taught me a lot about it, between essentially like centralization and decentralization, or coordination and like having a life to breathe of its own. So Saya and their local over there in North Orange County, part of the reason I would say that they're like a top 3 or a top 5 on this campaign is, as again, they take ownership. So they didn't call me or the lobbyists about getting a letter from Senator Newman, who, by the way, is the chair of the budget subcommittee on education. So the main committee, pretty important guy. But rather, much to my encouragement, just took ownership and just did it. So we try to strike that balance by having a level of touch point, and then sending people out on their own, knowing that they can call their assigned person at any time for coaching, support, etc. So like 1 meeting a month, it's achievable. 1 meeting a month for an hour, you can do some work to agendize it, whatever, but you can do that, right? One collective bargaining toolkit. That's the only material we've developed for the table in this entire campaign. It's all in there. I mean, was that some work? Yeah. Do we, you know, make sure that it was as good as it can be? Yes. But we put that out in September, October, when we started going to tables. We started going to tables in October. It's still all up to date. We haven't even updated it. So this stuff with a moderate but small amount of investment in a few infrastructure talking points, touch points, and then sending your members and leaders out and trusting them because they want this to do the work, like some real magic, you know, is going down. So it's thank you, Saya, for all of your leadership. And is there anything else that is coming up for you that you would want people to know, or John?
Oh, I was just looking at the chat, and I was going to try to address a little bit. It looks like Carol had a couple questions about working with NEA in California, and I could
Yes. We haven't. Should we get through? So we got one more slide, I think.
Oh, okay.
And then should we do those?
Yeah, I want to address some of those questions though.
Totally.
Okay.
I think we could do those like pretty quickly. So I think it's just one more slide. Yeah, one more slide. So this is a bargaining slide. So, you know, sorry, I need to not unshare that. Here you go. So, I mean, this is like all that I eat, live, sleep, drink, breathe right now. So it feels like, have we ever done anything but this? But we have. The value of coordination. Look, we have 27 locals that are essentially going to bargain the same topic at the same time, whether in full contract bargaining or as an MOU effects bargaining, the legislation, then pretty clearly there's an opportunity there to work together, to share tactics, to share the boss message and how you're overcoming it, to amplify, your position and your strength. So seeing that was not super hard. Figuring out how to do it was something new for our federation. Like I think many labor federations focus less on bargaining and more on political elections or legislation. And I don't believe CFT has engaged in, sort of deep, wide, coordinated bargaining programming. So, but it ended up being as simple as figure out what the right tools are, get them as good as you can, put them in one place and leave them there. One meeting a month, and putting people in relationship on a regional basis as well, sort of in pods. So in the South Bay, we got 4 locals there. We got 3 in the Bay. We got about 8 or 9 in LA. We got 4 in San Diego. There's outliers, which sometimes they talk to each other, but for the most part, there's some natural, you probably already, have done this or think this way, but they, just like people in a work site, like locals break up into natural sort of pods too. So that's the value of coordination. I'm pretty sure every single person who's bargaining at some point or every session talks about specifically the districts that have already implemented this, offers counter examples to the usual BS that they're going to get from management, which, by the way, we ID'd what their 2 messages were going to be before the first local bargained, and we covered them in a training because what it's going to be. Oh, it's too expensive, and oh, it's hard to administer. Sorry. So sorry. So that coordination has been key because it's not just, non-tangible sort of like examples from a talking point sheet. It's like, I know that president because I've been in meetings with her for 9 months and they were at the table for 2 months and they did this and they overcame it this way. And now they're implementing it using this form. Here's a copy. So kickoffs, we kicked off our second phase of the campaign, phase 2 bargaining at the beginning of last fall semester with in-person city-based multi-local meetings. 2 in LA, 1 in the Bay, 1 in Sacramento, Fresno, Orange County, San Diego. So the kickoffs were added a lot, and it tested our ability to mobilize members. The tools and practices, the main tool that locals use in phase 2 is a petition. And it's just name, department, college, and yes or no, I'm willing to help circulate this. And if so, you can call me here or email me here. If you are moving that document, which you can create in 7 minutes or copy ours and put your own photo or whatever, then you are generating a list of potential activists and giving members a way to feel like they have a say in their own future, a concrete way. So I know it's simple and some of you have probably been organizing a very long time and okay, I get it, petitions, whatever. For those of you who don't utilize such a tool in your sort of normal operations of your union, you might consider it more. It's instrumental because it's easy, it's accessible. It's an inarguable test. If you can't get 3 people to sign a petition, if a person can't get 3 people or won't get 3 people to sign a petition by clicking for 30 seconds, I'm sorry, but they are not somebody who has a following at that workplace. I have never seen someone who has a following at a workplace who can't get at least 5 petition signatures in a day. Won't is different, but so that's the main tool we're using is that, we got all the stuff in the toolkit as well. As far as organizing, that's the like meat and potatoes. Practices, escalation, the main forum for bargaining is the table and the board of, we consider the board of trustees our audience, not the negotiator or anybody else. That's our audience. That's who we target. As far as status, out of 27 locals, we have signed implemented agreements in 5. We're getting number 6 in the coming days. which is very fast considering we just started. I would say there are about 5 locals who haven't jumped in and participated in the way that they will in the future. And then the other, 15 or so are either actively negotiating at the table or actively preparing to do so and getting dates. As far as what's next, we need to collect the lessons from the implementation that's happening now to help future people that'll be bargaining. And everything's in place at this point. It's just pushing and moving and helping colleagues be present in supporting the locals that are doing this and leveraging all of the tools in our arsenal so that the elected boards of trustees know that this is a serious thing for our members. And if you don't get this across the finish line in your district, it's going to be very problematic for you, as problematic as we can make it for you in your career. So, and we don't do that with a letter or a lobbyist. The only way to send that message is with numbers. So locals who are not mobilizing to board of trustee meetings are gonna struggle. And so by participating in this campaign, they're developing a more active union culture, which builds their capacity, feeds it. Anyways, that's all I got on this one, which is John or Saya, you want to say anything about the bargaining phase, and then we'll do Q&A and stuff.
Well, in terms of the bargaining phase, there is a bit of a I think that what we really need to do is, as we get more locals on board, it will build, in other words, the network effect of getting the freeway flyers covered, I think, is going to be another bit of a phase as part of this phase, because while we do have some solid, good sized locals that have already now TA'd and actually have MOUs on this, as you heard, a lot are bargaining right now. But we also have the other locals that aren't CFT locals, which are NEA locals. And quite frankly, they're not, let's just say they're not as responsive to contingent issues as the CFT is.
They're behind the 8 ball like you wouldn't believe.
So this is what I want to get to in some of the questions about NEA. So the landscape in California is that we have 72 districts. The majority of the community college districts are represented by either CFT or CTA. There are a handful of districts which have their own little local association, and there are a couple of part-time only districts that are UPD CWA. But generally, we're split between CFT and CTA. CTA is the NEA affiliate, right? The demographics are different. So even though that the CTA, the NEA affiliate, is a larger organization than the CFT in terms of members, they are overwhelmingly K-12 members. So I don't know what the numbers are, but let's say it's about 90% or so. Oh, yeah. So they're the big dog in K-12 in California. But arguably CFT, even though we're not as big as them, we have more of our density is in community college locals. We're primarily K-12, but a pretty large chunk of our members are also community college. And then we have some classified paraprofessionals as well. So our demographics are a little more balanced. And so CTA, the higher ed in general in CTA is not really prioritized. This is my subjective. And
you're a board member, man. I've only been here 2 years.
And within that, they are not that responsive to contingent faculty the way that CFT, the AFT folks that we are. They simply aren't. They don't have the same part-timers in leadership positions that we have in CFT, and they just don't have the same emphasis. So they're not against what we're doing, but they're simply not present. CFT has pretty much done this from the get-go, and only one CTA, NEA local has actually signed on this. All the rest have been CFT locals. So that tells you where we need to go in the future on this to get that network effect to work. So obviously we're CFT, we're focusing on getting our CFT locals everything that they need to do the job. But at the same time, at some point, we are going to have to figure out how can we prod our sibling organization to do the same thing, because quite frankly, they're not doing what we're doing in terms of working on contingent faculty issues in the same way that CFT is. And I'm speaking now as a contingent faculty member in CFT and a CFT leader. And I find it a little disappointing. I don't know where you guys are. I mean, some of your states may be merged. I know there's a lot of staff people here, so I'm talking a little inside baseball, but I see that as one of the challenges of the campaign, is to broaden it outside of the AFT locals, because we haven't really done that. We're still working on getting all the AFT locals on board, but at some point we'll have to figure out, how can we prod them to do what our locals are really actively doing right now, because that's not really happening on the other side.
Yeah, it's
Sorry,
good.
maybe that's too much inside baseball.
No, it's
but-
good. Like Jeff said to me, I think Jeff that said these words one time. It was like, I forget what it was in response to, but it's basically like, how much should we go out and build strategic partnerships with whomever? And he was basically like, get our house in order first.
Yes.
And that's what this campaign is doing. So
And let me mention something else that we didn't really, and this is a little more inside baseball, but one of the things that we've noticed in doing this campaign is not only do we see which locals are really strong and are really carrying the ball and are really pushing at the negotiating table, but it also has highlighted a little bit of the soft underbelly of some of our locals that quite frankly need more assistance from the state organization. And I think one of the things that in my mind as an organizer type is, okay, we see who's doing a good job and we see who could be doing a better job. How can we give them the resources? How can we help them to kind of move on this faster? Because quite frankly, some locals are moving at different rates. And there's a lot of reasons for that, but that poses an organizing challenge. And this has illustrated that, it has brought that to the fore. And so I think that in the future, we can also look at, one of the advantages of doing this kind of campaign is you do see the warts, you do see the soft underbelly, you do see where we need to do the extra work. And that is also starting to become apparent. I mean, it's overall wildly successful. This is a fantastic campaign, but it illustrates some of the points where we have to focus.
glaring. I'm glad you made that point, because, politics aside, like, you just need to have an assessment of where you're strong and where you're weak. And we're very strong in some places, and we're extremely weak in some locals that seem to be hanging on by a thread. And it becomes, if you're tracking the participation on certain things, it just is clear as day, so.
Yeah, and I want to say, just from the perspective of being in both CFT and the other union, the other California union, I'm a member of both. And I can say from my experience that I feel the support through CFT only. And as a side note, I'm a lead plaintiff on a class action in that other district, approached for that other union, approached by that union to do this. And even that is, we have to keep reaching out, like, what's going on now? What's the latest? And so we just keep doing this work. I keep saying yes, and getting into good trouble. And being part of both unions, I can see that there is a difference. And how do we branch out with that other local? Do we give them all of our research and our toolkit, that are all the hard work that we've done? That's a question I don't have an answer to.
I mean, somebody that I respect, who's our organizing director, Sandra, her take one time in one conversation that I liked was like, yeah, this is all in theory, right? we're not the ones who decide this. It's like, I'd be fine to give it to CTA. The independence is another story. If you choose not to be part of a union so that you can save money and have your little mom and pop shop, which, by the way, it's impossible to win $200 million or run any statewide campaign as an independent, non-affiliated. It's just, maybe I'm wrong. So one take is like, you're a union member, let's go, take it, But if you're not a union member, how are we going to be using our members' dues to pay for campaigns and hire staff and develop programming that we just give to you for free when you're sort of actively, not joining our movement? Is one take from someone that I respect. And also, getting your house in order is important. I will always been over eager to build partnership before getting, our business.
When you work on contingent faculty issues, this issue comes up more than on other issues because so many of us teach at multiple districts. And as Saya just said, some may be CFT districts, some may be CTA, NEA districts. And you do kind of see a difference in how the two organizations operate. And quite frankly, you notice the lack of certain people, certain contingent faculty being represented in leadership positions in the NEA locals. It's kind of striking. And because we have our CFT part-time local meetings of the committee I chair, we hear this a lot about, like what Saya just said, well, in my other local, I'm getting, shit on, and in the CFT when I'm getting assistance. And it comes up a lot when you talk about contingency because we have that cross-pollination that doesn't exist in other faculty positions. If you're full-time, you're not going to be that familiar with another district.
Man, you know where else it's going to come up?
That's another thing that's come to light in this campaign.
Once this really gets rolling, man, you know where else this is going to come up a lot? Independent local unions that are not effective, that see what we've done and want to.
Yeah, and Chase, just to cue them in, because maybe they don't know the whole full landscape here, but in addition to the locals being split among CFT and CTA, the NEA affiliate, there are a significant number of what are called the triple CI independents, California Community College independents, and they are not affiliated with any national or state union. They have their own little association.
$20 flat fee,
Yeah. And we do our best to pick them off a little one at a time because they see what we're doing and then they feel like their little network is not as effective as it could be. And of course it's not, because it's hard to compete with a real statewide network and in fact a real national network, which they are not.
The only non-organized
factor also in our organizing in California. So we have, it's a complex landscape. And then there are non-union associations, which are very involved in higher ed. And then there are some specific ones of those that are part-timers only that form their own associations because they didn't feel like their union was representing. So we have all these groups. California is very big and diverse, as you probably know. And maybe you have some of the same dynamics in your states, but it's kind of an overwhelming challenge to kind of keep it all from falling apart sometimes.
That's why I wore a hat instead of taking a shower. I don't have time for that stuff.
Questions?
All right, yeah, we have about 5 minutes left. Any other questions? And feel free to ask them directly.
Yeah, hey, John and Saya, you want to put our info in the chat too for people? I'm gonna put mine. I can put yours if you want. Whatever.
Yeah.
Hey, let me jump in. First of all, thanks all for a great thought-provoking presentation on stuff. One roadblock we've hit Rhode Island on the bill we've been working on is the lack of good data. So talk a few minutes more about that research that you got. Good data is really critical as part of the legislative process, and I'd love to hear a little more about how you got to that point where you had such a great tool put together.
Well, so, I think we face that at every level of our union. So not only does it not exist in any coordinated fashion with the state chancellor's office, locals don't even receive the information they are supposed to by law receive from the employers, the names and the conditions and contact info of their own members. So the problematic data stuff pervades everything, in my opinion. And so we just knew that we had to have something to go off of to be able to make tangible claims. And so our research director, Amy Schreck, and she would speak to you, or someone else about this. What she did that was instrumental in the legislative phase was, so we said, okay, we've imagined the bill and its outcome, right? Which is, those 4 conditions. So let's identify that out of the 72 districts, because we went through all of the, there's more than 72 contracts because some are split units. We went through all the contracts. We mapped out the status of part-time health insurance. And so she said, okay, let's ID the 5 and the 7 districts that are closest to the outcomes we're looking for. So they have the most expensive, highest quality plans. They have the lowest eligibility thresholds. They have the, I forget what the other things were, but like the best of the best examples. So we ended up, the 5 was 7 better than the 7. So we ended up using the 5, and then nobody knows how many part-time faculty there are. So we estimated, gave it a conservative estimate. I was upset about that. I wanted to keep the number lower, but gave it a conservative estimate with duplicates, whatever. And then just extrapolated your number of part-time faculty overall working. The enrollment at each of those 5 good examples had about a 35% enrollment rate into healthcare plans. It's between 30 and 40 at each of the 5 districts. So we extrapolate, we say, okay, if the average is a plan's going to cost $12,000 a year, and we know that 35% of faculty enroll when these conditions are met, then when we meet the conditions with a bill, presumably about 35% of all faculty statewide will enroll. That's, out of the 35,000 presumed that exist, times the cost annual dollars you get. I'll send you this, which breaks that out into basically different models that range from like 140 to maybe 198 or something like that. And we didn't cook the numbers to look like that. It really shook it. We didn't even ask for 200 as it happened. With that, we weren't in there saying 200 is the number, is what I mean. Does that help, Jim?
Yeah, it really helps, and I think you're smart to offer some conservative numbers because it bolsters your credibility, and it probably made the governor feel a lot more comfortable once he took the dive.
She was totally right about it. I feel it every time I talk about it too. So I just put that in the chat, a document called cost scenarios that lays out what I just said. Thank you, Andrew.
Yeah, Amy Schreck, our research director, is top notch. And as I was telling Nicole earlier, the research piece of this was really important. And we recognized that if we were going to move the legislature and the governor, we needed numbers. Even if they were estimates, because some were ballpark, because we did the best we could. And our numbers are better than anybody else's in the state, including the chancellor's office, because they don't gather this kind of data. They don't gather these data. Nobody really knows how many, the estimates are like 30 to 40,000 part-time faculty. Nobody knows because a lot of people teach at multiple districts and there's no central, it's just crazy. Also, our research department is really on the ball, and they have been gathering research that relates to this as well over the years. We do a very comprehensive salary survey every year of all full and part-time, all 72 districts, CFT and non-CFT, compare all the salary schedules, tease out variables and rank them and put a dollar amount. And it's very useful information when you're at the table and you can say, well, we're in the bottom, whatever in our salary or, whatever. And compared, who has office hour pay for the part-time, everything. So it's a comprehensive survey once a year that everybody uses. Even the non-CFT locals use that, the bargainers use it, and we all use it. So our research team has already been churning out lots of really useful reports. And some of the data was gathered by documents that the district submits to the chancellor's office each year. So she was able to put together a lot of stuff. The surveys were amazing. And it was a really instrumental part of the campaign, was having the good research from the beginning.
We're happy to.
Yeah, I just want to add to that. We did the information request for like 3 years back when we started this. So we had, we could tell, because we do have a reimbursement program, which is, like Jeff said in the very beginning of this, like 5 cents to the dollar. And so, I looked at the numbers, and our district spends about $240,000 every year on reimbursement program for about 105 part-time members who qualify for the reimbursement program, because even those have some strict rules, including like when you turn in the form and all this stuff. But anyway, so we did that in the very beginning, and then what started happening is when we started hearing from from the district, oh, well, you know, it's going to be too expensive because there are this many, you know, part-timers in California. It's like, yeah, but you're also double counting. I'm in 2 districts. I'm being counted in both, you know? So that, and we have other people that are in 4 different schools. They're being counted 4 times. So that's we held that information until it came up in bargaining, and then boom, we hit them with it. Well, you're double counting, you know, because that part of our meetings that we were doing on our Wednesday meetings is hearing like, this is the backlash you're going to hear, because this is what we're hearing from the CFOs and the CEOs and, you know, all the you know, greedy people. This is what we're hearing. So this is what you're going to hear. And this is how you can counter that. And that has been very, very instrumental. And we've got all these counters banked. We have them banked, and we're putting them out right when we're right when they say, like, cost of doing business, Fred. Like, I want that on a shirt, you know. So
when we met a year and a half ago, Saya, I didn't experience your speech the way that I do now. Like, you're a motherfucking badass. Like, I love, like, you talk wonderfully as an artist and a presenter already, but as far as a union leader, it's just a pleasure to work with you this amount of time and see you stepping into, you know, these leadership behaviors and how you carry yourself in front of the room and stuff like that. So, and this is not, you know, this is not a lobbying campaign. This is an organizing campaign.
But we're all doing it together.
Yes. And that's why
I didn't know about trailer bills. You know, I'm an artist. I'm not a politician.
I didn't know about them either.
Trailer bills. Yeah. Now I know about trailer bills and Senator Newman, and, you know,
yeah,
I care now. I care a lot more on our, yeah.
Totally. So I feel really lucky to grow, you know, with people who are growing their organizations, and it's an organizing campaign, just we're doing it on lead stuff. So
yeah.
For what it's worth, whatever y'all, you know, want and need. If you're looking at contract language, you should probably contact us, because we did heavy training on some of that, but some of it's like pretty self-explanatory. John, yeah.
I can put a link into the contracts page that I have.
We bought, yeah, there's one in there already, but yeah, do yours too.
I'll do that.
John scabbing the CFT website.
I have my own Contingent World website on all kinds.
I use your website all the time, John. I just need you to know that. And I share it widely. I hope you get paid for that.
Get paid for it? Are you kidding me?
Well, we need to do a GoFundMe and get you some money for that, because I have it bookmarked on all my computers.
I love
that. On that site, I also have links to every community college faculty contract in California.
Yep.
Jeff Johnson, that guy did like half of them. Like he loves doing, some people just love stuff like that. I like do as many.
Yeah, and that's a thing too, bringing up Jeff Johnson. So Jeff has also done a lot of interviews and keeps this in the discussion in print. So that is something that's really important too, is just kind of keep this conversation and the language out there in the universe, so it kind of just subliminally gets filtered into people's psyches, that we deserve healthcare. Have a heart.
Yeah, that's something that our federation does a very good job of. I mean, working at unions for a long time, like one thing that a lot of unions, at least here, struggle with is like talking about the good things we've done. We can do them, but we often don't communicate about them. I'm looking for links to what Say was talking about for you, but a lot of good newsroom, here you go.
I know we're probably getting at the end. So I just wanted to kind of reemphasize, healthcare is such a powerful issue. So to replicate a campaign like this, I mean, you can follow the same framework on any issue. I just have to say, if a lot of your members don't have healthcare, to me, that's a logical focus. We're still in a pandemic, and it's just not okay that our members don't have healthcare. And, you know, if we're going to wait for national Bernie Sanders healthcare, we're going to be waiting for Godot. So, because I've heard people say, oh, well, we just need to work on universal healthcare. Well, that's true, we do. But in the meantime, we need to get our members healthcare. So don't forget about those contingent or part-time faculty members that are part of your unit when you're thinking about healthcare, because I'm assuming that the majority or almost all of your full-time members probably have healthcare packages. And I'm also assuming that probably the majority of your contingent faculty don't get district benefits. I don't know if that's true in your particular area, but it's certainly true in our state. And we're a pretty deep blue state, so it's pretty disappointing. And healthcare just made such a logical issue to focus on, not just logical, emotional issue to focus on. It's really hard to argue against people getting healthcare. It really makes people look bad when they have to say why they can't give you healthcare. Oh, administrative cost. Oh my God, HR would actually have to do their job. Oh, it's so terrible. Yeah, well, guess what? It's terrible not to have healthcare. You sound like somebody who has healthcare. So just, I want to put a picture. I think that as a union, wages, benefits, and job security are the big three. Benefits are huge if you don't have them. And most of our members in higher ed don't have them. And I don't think that's acceptable. I think a focus on healthcare is something that we all should really keep doing. But that's just my little spiel. As somebody who has healthcare but could lose them at any time by losing a class.
You know, it's probably why you teach in Korea for the most part. I agree with everything John said. It's a powerful issue.
Yeah, we are at time. So final thoughts, final questions, take note of links in the chat and contact information for questions that will occur to you later.
I just wanted to say thank you all. This is something I've been looking into for my own locals in Pennsylvania, as well as our graduate student organization. And I also wanted to say I appreciate the freeway flybys. There was a time early in my career when I actually worked at 6 different schools. So I understand that that conundrum completely, but thank you all. This has been really illuminating.
Thank you. Anything we can do to, you know, it's up and running. So if there's something we can do, you know, in another place to be helpful, we're happy to.
Always.
And if anybody wants a presentation for your own state, let us know, right, Chase?
Sure. Yeah.
Right, Sam?
Yeah, I travel.
I think we need to work on the legislative part of it first.
Yeah.
Right. You want to close us out, Johnny or Saya?
Oh, I did my spiel.
No, you have a quote.
Toodles. Oh, you
Wait.
got a quote?
We have a quote by Angela Davis. Nicole, you should say it.
All right. I just want to make sure that I get this right, so I'm pulling it up. I'm no longer accepting the things I cannot change. I'm changing the things I can no longer accept. Hope to be in touch with all the rest of you soon, and hope you all have a good afternoon, evening, wherever you are.
I say we close this out on the we version of that. We no longer accept the things we cannot change, right?
Yes.
We are changing the things we cannot accept. We're in this together, everyone.
Oh, one final note. I just thought of something.
You got a final note to Angela Davis quote?
Well, no, I can't beat that. But, another thing that we're doing in California that I think is actually, in my opinion, even more exciting, but hasn't borne any fruit yet, is that we are looking at forming a strategic plan to transition from our current 2-tier system in higher ed to a true 1-tier system without any contingent faculty, a la the Vancouver model or the K-12 model or whatever you want to call it. And CFT is leading that charge in California. It's a kind of what we call ending the 2-tier system in community college has actually become a little bit of a movement in California, and CFT is leading that right now. So I hope that you hear more about that in the future.
Yeah,
But
man.
this is going to be an interesting year.
It's like a thing that is unimaginable now in the way that like anything but a monarchy was unimaginable in like 1400s Europe or capitalism now, you know. But John's a dreamer. He got a resolution passed through our e-board unanimously to create this task force, and it forms in March.
Yeah, we look forward to seeing you back again, John, to talk more about that.
And Say is on the task force too. We're going to rock it.
Yay.
Right.
We're gonna rock it.
All right.
Okay, East Coasters, y'all are staying up late for this one.
I know.
Thanks, everyone.
And Chase is the one yawning over here.
Have notes.
Thanks, everyone.
Thanks, everyone.